Dr. Nelson Adams is currently a board member for the Health Foundation of South Florida. To say that he is a giant in this community on issues affecting women and their children can't be overstated.
I live by the mantra, and it's not my mantra, it's actually recorded in the Holy Writ. It says, to whom much is given, much is required. Because of that, I recognize that I've been given a great opportunity. I was born here in Miami in an area called Overtown. Both of my parents were educators. They taught me the fundamentals of recognizing that you are no better than anyone else, and you're certainly as good as anybody. Overtown, for many decades, was a blighted community and one of the poorest communities in not only our county, our state, but in the nation. But when I was born there back in the early 50s, it was a thriving community. It was considered the Harlem of the South. It's been very good, it's been very bad, and now heading towards good again. It was a great place to start, and it's also a great place to finish. I was born there, and I still do a significant amount of my work in the Overtown community. To Howard University in Washington, D.C. And after finishing undergraduate school, I matriculated to Meharry Medical College in Nashville, Tennessee. Got a MD, and while there, realized that OBGYN was probably the specialty that was best for me.
Dr. Adams has been responsible for the birth of 10,000 children in this community, and we know how important it is for him to provide respectful care. That's what he talks about, taking care of the women, because that's his way of taking care of the family.
So I really thought that if I could impact the life of a mother, that I had a better chance at impacting the life of a family, a community, a state, a nation, maybe even this world.
Dr. Adams is an inspirational leader, first and foremost. He makes you believe that you could do anything. He is a moral compass for those of us who are doing this work.
Everybody needs to have access to healthcare that's available, healthcare that's affordable, and healthcare that's accessible. It's about equity. We have to be our brothers and sisters' keepers. Truth be told, we are the ones that we've been waiting for. Nobody else is coming to help. We have got to do this. To whom much is given, much is required.
I can't think of a significant organization in this community who is advancing equity, who isn't looking to Nelson Adams as a trusted voice of the issues and the opportunities we have to do better.
Several years ago, I had the honor of being president of the Dade County Medical Association. And shortly thereafter, I became president of the National Medical Association. And using that platform, I had an opportunity to address Congress on a number of occasions, talk to state legislators frequently, and try to have an impact in the local political arena as well. I feel it is an obligation, a responsibility, a charge, if you will, for me to do all that I can to make sure that that rising tide of technology and greater pharmaceuticals and the like is good not just for some of us, but for all of us.
The power of Dr. Adams transcends just what Dr. Adams touches with his own mind, his own heart, and his own hands. He's also a mentor in this community. So many of us are a reflection of the work that he has been advancing and the efforts that he's made to help inform us, educate us, inspire us.
Those folk who are my ancestors, who sacrificed so that I might be able to go to college and to have a better life than they had, I stand on their shoulders. They're the ones who sowed seeds that grew into trees of opportunity for me. It's our time to do the same.
I think I speak for so many people in this community, the women and the children who he has served as a physician for, CEOs of nonprofits, community-based organizations, young physicians, medical students, when I say thank you, Dr. Adams, for all that you're doing to make this community a better place.
To whom much is given, much is required. It's my duty, it's my responsibility, it's my calling, if you will, to do all that I can for as many as I can, for as long as I can.